It is Thursday, August 10th, 2023. Hi, it's Tim, and this is my weekly, we'll call it a health update, since there's really no major progress on my cataracts this week. Um, Other than putting in eye drops, that's all that happened. And, well, I did hit my 5 week mark, so I've got less than a week to go now before I'm done with eye drops. So Tuesday of next week. Then I don't have to take them anymore, other than liquid tears if I want to, until the next procedure. So, what did happen this week? Well, on Monday, I had my second therapy appointment. This one was online instead of in person, which cut out the stress of having to get myself ready, drive over to the doctor's office and back. Much appreciated. Although there was a bit of a hiccup. They have my email address spelled wrong. So the link to the web portal wasn't sent to me. I had to call into the office to get it. The session itself went great. Basically just reviewed how my last 2 weeks went, my progress and observations of what happened. And essentially the plan is to stay the course, work the plan, build those, I guess, mental muscles, and work on lowering my overall stress and conditioning myself to have a healthier response to stimulus that would cause me to stress out, have anxiety, or build up tension, and just learn to release it and let it go. So the next appointment scheduled. Now I've got the link, so it should go even better. Let's see. After that, I had a couple phone calls from other doctors. So I heard first from the ultrasound office, or the imaging office, where I was going to get my ultrasound done. And they called to schedule my appointment, which ended up being Wednesday at 9 o'clock. There's a funny story with that I'll get to later. Then, a little bit later, I got a call from Bay Health here in Dover, and they had to cancel my iron infusion appointment this week. Well, all of them, really. I guess there's something going on with supply or whatever. So my iron appointments are getting bumped back a week, and I guess I'll have one more week added to the end of the schedule, which will set up when I go in for my appointment on Tuesday next week. Then on Tuesday this week, I had a follow-up visit with my primary care doctor, just reviewed where things were at, labs and other things, and then scheduled a phone appointment for next week just to review the results of the ultrasound that happened on Wednesday. Also, while I was there, I made sure that my email address was corrected in the system, and I am now getting emails from them, so that makes things easier. The other benefit to having that email address is I should be able to go into the online portal now and fill out any paperwork before I go into the office online, instead of having to do it on the little tablet kiosk things at the office, which I've got to pull out the magnifying glass, and it's just awkward. And probably raises the stress level up quite a bit. If everything goes smoothly, next appointment, all I'll have to do is put in my name and birth date. That'll be awesome. All right, so the ultrasound for just getting imaging of where my hernias might be, went very quickly. Although the technician did caution that if the imaging is even necessary, they'll probably have to go back and do a CT scan, because ultrasounds, they get too narrow of an image and a CT scan will give the complete picture of exactly what's going on. So I got that to look forward to, possibly. Let's see. After the ultrasound, I did talk to my brother. He had a hernia several years back, just to get his input and experience from that situation. He mentioned, when you get a surgeon, make sure that they're not about ready to retire. His was. I think he retired later that year, from what my brother said. And, well, he was competent, but he lacked some of the precision he probably had back in his glory days. And so, like, the sutures, the knots were not cut off as closely as they could have been. And he felt it for about a year, maybe 2 years afterwards. Unfortunately, these sutures aren't ones that you put in and then remove later on, or that dissolve, because they're designed to integrate with the mesh that they put in to strengthen the abdominal wall. And so it's kind of a permanent fixture. So integrate, not disintegrate. Anyways, so I've got that to be aware of. And what came out of it is I decided, when I talk with the primary care doctor next week, I'm basically just going to request, do whatever the insurance requires, but I'd like to get a referral to a general surgeon who's going to be an expert on this and actually do the operation. As I'd rather not wait around on things for like any complications to happen. I've gotten myself into trouble multiple times already by waiting around to have issues resolved rather than getting them addressed immediately. If I'd gone to the emergency room when I first started having symptoms of ulcerative colitis, it might not have even developed into ulcerative colitis, or at least not this soon. And so, lessons learned. I don't want to sit around waiting any more than I absolutely have to. I know there's a process for things, whether it's medically necessary or necessary because of insurance, but, I don't want things to drag on. Let's see. So yeah, next week I've got a phone appointment. Oh yeah. Basically the way it worked out is 9:30 Monday, I have my therapy appointment. 9:30 Tuesday, I have my primary care doctor appointment. And then 9 o'clock on Wednesday, I had the ultrasound imaging appointment. But I put them all at 9:30. So they called me up at about 9:15 asking if I forgot my appointment. I'm like, no, it's on my calendar for 9:30. And they're like, no, it was for 9. I was like, oops, my fault. But they managed to get me rescheduled for 11 that same day. So I really appreciate that office. They put up a lot from me, and provided great service. So not a whole lot going next week. I've got the follow-up with my primary care doctor over the phone. Hopefully I've got an iron infusion appointment if it does not get canceled. And I think that's about it. So between this week and next week, I'm hopefully going to update a few extra videos, maybe just going over some of the coping techniques and things I've used to adjust to both the ulcerative colitis and to the cataracts. And so hopefully some of that will be useful to people. And I would love to hear any tips and tricks that you use for your own, health situations to get through life a little bit easier. All right, I think that's enough rambling for today. Have a good one.